I'm Rogelio Saenz, and I'm a sociologist and demographer at the University of Texas at San Antonio. And I was invited to participate with the LRI with respect to its COVID-19 initiative, the research that has been going on, and I've really enjoyed the collaboration. I have been putting together data and keeping track of COVID infections and deaths in the Latino community. Started doing that in late March, early April, and every week then I've adjusted the numbers, and so it was very obvious that the Latino population was going to hit the 100,000 deaths in the community. So I started preparing that data. That 100,000 is a significant mark, and I think that if we take a look at a city in Texas, for example, the city of San Angelo, San Angelo would have about 103,000 people in its population, and that right now is about the number of Latinos who have died in the nation. So we're talking about the city of San Angelo. If all of a sudden, God forbid, that everyone died in that community, that gives you kind of an idea on the impact in terms of the number of Latinos who have died nationally with COVID. Estimating that on average, the typical Latino person that has died in Texas would have had another 20 years of life expectancy ahead of them were it not for COVID. So that's a significant loss. And at that time, I was estimating that about 60% of all the person years that have been lost in the state have been with the Latino population, so 60%. With the white population, if you look at the white population nationally, about 90%, close to 90% of whites who have died from COVID have been 65 and older. In the Latino community, it's only about 62% or so that are 65 and older. So you really have the workforce, particularly individuals 50 to 64 years of age. There's more than a quarter of all persons, Latinos who have died, have been 50 to 64, compared to about 9% in the white population. This really reflects the extent to which Latinos are in the front lines, unable to work from home. And I think that coming out of the pandemic, whenever we come out of the pandemic, and whatever that resembles, that it's going to be essential that we address those inequities, racial inequities that have been in existence since the founding of this country, and that has made people of color particularly vulnerable during the pandemic.